One of my patients once said to me that it just feels like I want to take a bottle brush to my vagina. And I couldn't possibly say this any better. Hello, welcome back to Gyno Info. Or if this is your first time, just welcome. I'm so glad you discovered us. In this podcast, we discuss common gynecological problems in a frank and open way that a normal, everyday woman can understand without having to read a medical dictionary. Today, I'm going to deal with a topic that comes up a lot. In fact, it comes up over and over and over. It's a topic that is near, but definitely not dear to all of us, to many women. I will talk about vaginal yeast infections for short. I'm also going to talk about some useful way to deal with yeast infections that keep coming back, the so-called recurrent vaginal yeast infections. Some people call them chronic, but the correct term would actually be recurrent vaginal yeast infection. These are a big problem for some women and have a major and negative impact on the quality of their lives in general, but also for their sex lives. It is commonly said that about 3/4 of women will have a vaginal yeast infection sometime in their life. But in real life, I think it's probably a lot more common than that. I don't think I've ever met a woman who said she had never had a vaginal yeast infection in her life. And between 5 and 10 in 100 women will have so-called recurrent vaginal yeast infection. This is defined as 3 or more yeast infections a year, and that is truly miserable. The two main symptoms of vaginal yeast infections are vaginal discharge and itching. The discharge, the fluid that drains from the vagina, is typically clumpy, like cottage cheese, sometimes a little greenish, but it can also be more liquid and thinner. Mainly, it's just too much discharge, though some women have no abnormal discharge at all. They're just itching. The itching is around the vaginal opening, but also over the whole vulva, the whole crotch, and also towards the back around the anus, the butthole. One of my patients once said to me that it just feels like I want to take a bottle brush to my vagina. And I couldn't possibly say this any better. You know what I'm talking about. Sometimes irritation and burning, especially after you have been rubbing and scratching, sometimes you do that at night without even knowing you're doing it. This scratching causes irritation, and so it will make it hurt when you pee. Urine is salty and stings when it hits the irritated skin. And the irritation will lead to swelling and redness of your vulva, your crotch, your entire genital area. The redness can even extend onto the skin of your thighs, onto your legs, as a red rash with very sharp borders, looking very much like a diaper rash on a baby. A typical sign is also that even though you have too much discharge, intercourse will feel dry and it hurts. It can feel like sandpaper. Unfortunately, there are many other conditions that cause similar symptoms. That includes bacterial vaginosis, BV, that you learned about in one of my other podcasts, trichomonas, trick, a sexually transmitted infection. That's neither a bacteria nor a virus. But other vaginal infections with bacteria and even skin allergies can make the same kind of itchy symptoms or discharge and burning. This is why it is so important to make sure that what you think is a yeast infection really is a yeast infection before you treat it as a yeast infection. And you will be wrong more often than not. More than half the time, your diagnosis of a yeast infection will be wrong. According to scientific studies about how good women are at self-diagnosing their yeast infection, only about a third of women who think they have a yeast infection actually have one. Even those that had yeast infections before do only slightly better. The pharmacy clerks who want to sell you all sorts of products and creams are wrong just as often as you are. Letting the pharmacy clerk treat your vaginal infections with non-prescription medication wastes your money on products that do not work. It also wastes your time and is frustrating because it will not make you feel better and will take forever till you get better. And often makes things worse because it will take longer to treat you once you get the right medication, as the irritation may have gotten much worse from the wrong medication or just a delay in treating it right. So you always have to have the right diagnosis before you can treat anything correctly, not just yeast infections. And interestingly, what also has been shown in several studies is that a phone diagnosis of a vaginal infection by an office nurse or even by a gynecologist is no better than you or the pharmacy clerk. The truth is that the only way to be sure someone has a vaginal infection is to actually look at the discharge from the woman's vagina under a microscope and actually see yeast or something else like trichomonas or signs pointing to bacterial vaginosis, BV. And all these things need to be treated with prescription medications, not something you can get without a doctor's order. This is actually why my office nurses are not allowed to treat vaginal infections over the phone, even if the patient swears that she's sure that this has to be a yeast infection. But the woman is given an appointment right away, not because it's really a true medical emergency, but because all of us also have crotches. And we know how miserable it is to itch like that. We will not make you wait for another week or two for an appointment, but we'll try to fit you in as soon as possible. It is an exam that can be done quickly and accurately and doesn't take much time, so we can always find a slot somewhere. But remember again, your doctor will need to see the discharge, the fluid in your vagina, not the stuff from the pharmacy that you may have put in already. That is why you need to go and see your healthcare provider before you start treating with non-prescription creams, douches, ovula, or whatever else the pharmacy clerk is going to try to have you buy. You also do not want to try to clean up and douche before your doctor's appointment, because that would wash out the discharge that the doctor has to examine. We need to see things in the raw, even if it's gross. We can deal with it. And at last point, you also should not have sex for a couple days before your appointment. Common sperm in there is not going to help my diagnosis easier. One big exception from that rule of never treating a yeast infection before your discharge has been examined under a microscope is that if you have just been treated with antibiotics and now have vaginal itching and a typical yeasty discharge, then even my office will call in a prescription for you. This brings me to what causes vaginal yeast infections. Yeasts are a fungus that is part of the normal mixture of germs that live in the vagina and that make up your normal discharge and cause the normal smell. Only if for some reason this normal mix is out of balance and the yeasts take over, and there are too many of them, will you develop symptoms like too much and an abnormal discharge, burning, itching, irritation, all that stuff we just talked about. One way that yeast can take over is when the normal bacteria that usually share the space in the vagina with the yeast are all killed off by an antibiotic. When you take an antibiotic, let's say for a throat infection with strep bacteria, that antibiotic does not just kill the strep bacteria in your throat, it also kills the good and normal bacteria in your gut that help your digestion, and also the ones in your vagina that keep the yeast under control. This is one of the important reasons that one should use antibiotics only when they are necessary, not just for good measures, like when one has a cold and a cough, and you think, well, take some antibiotics, it'll get better faster. It does not. Antibiotics are potent infection fighters, yes, but they're only for infections with bacteria. Using them for viral infections like colds do no good. It just causes damaging side effects, like diarrhea from hurting the beneficial gut bacteria, and vaginal yeast infections by killing the normal bacteria and letting the yeast take over your vagina. Bad picture, huh? Another thing that favors the yeast over the bacteria in your vagina is diabetes, especially if the diabetes is not treated well and the blood sugar is too high. When the sugar is high in your blood, it is also too high in all the other juices in your body, including your urine and your vaginal fluid. Even though the yeast in your vagina is in no way the same kind of yeast we use to make bread, all bakers know that yeast dough rises faster if you add a little sugar to the yeast. This is the way poorly controlled sugar diabetes favors the different yeast in the vagina and predisposes to vaginal yeast infection. It makes the yeast grow faster and better. And even if you don't have full-blown sugar diabetes, but you eat or drink a ton of sugary food all day, your blood sugar will go up every time you do that. And so will the sugar in your vagina, and the yeast will start growing like crazy. Not exactly what you want to happen, Also, the sugar in your blood will be converted into fat very easily and then stick to all the places you don't want it. I recommend nibbling on celery sticks instead if you're prone to yeast infections. You might also find something on the internet in a so-called candida diet or yeast diet. That is basically a sugar diabetes diet. It may not completely stop all your yeast infections, but it's a very healthy diet, so it can definitely not hurt. Other things that make you more likely to have vaginal yeast infections are a weakened immune system. That can be from chemotherapy, it can be HIV, it can be medications that weaken your immune system, or even something you're born with. Some women's bodies just are not good at fighting off too much yeast in their vaginas. Yeast infections are also more common in women who have sex, which is related to them also being more frequent in women who are using birth control. And it doesn't matter if it is a birth control method with or without hormones, if it's an IUD or a pill or a diaphragm. But women who never had or never have sex can also get yeast infections. Now we finally get to how to treat vaginal yeast infections. Once you have shown that it really is a yeast infection, the treatment is quite easy and almost always effective. Vaginal yeast infections can be treated with pills taken by mouth. Those in your prescription. They can also be treated with creams or ovula placed inside the vagina to the irritated areas around on the outside. Some of these need prescriptions and some do not. Or you can use a combination of pills and creams. How long and with how big a dose you will need to treat depends really on how severe the infection is. And that usually depends on how long you already had it, which is a good reason not to waste time and money with non-prescription treatments that often don't work. I generally prefer giving a pill by mouth together with a prescription cream to be rubbed into the itchy areas on the outside twice a day until the itching gets better. This may take 2 or 3 days or even more, depending on how long you have been having the infection. And if it's a pretty bad case, I double up with a second pill about 3 days later, and sometimes a third pill 1 week later, and then a fourth 1 month after that to keep it from coming back, especially in women who keep treating themselves over and over with the over-the-counter douches without ever getting better. For those women, I also add an after treatment with live lactobacilli, the main normal bacteria in the vagina that are needed to keep the yeast under check. This is mainly because all the over-the-counter stuff is likely to have damaged the normal mixture of vaginal bacteria, so those have to be put back. And keep in mind, these normal vaginal bacteria cannot be taken by mouth as a capsule because they will just get digested in the gut and may be good for your gut bacteria mix, but certainly not get to your vagina. You have to put these vaginal lactobacilli capsules directly in the vagina where you need them. There are actually non-prescription effective yeast treatments, but these only work if it is really a yeast infection that you're treating, which more often than not, more than half the time, it is not. For all the other things that cause vaginal discharge and irritations, there are no non-prescription treatments. If the itching is killing you and you can't go to a clinic, you can try to use a non-prescription vaginal yeast cream. But once you have decided that this is what you want to do, you will need to give it at least 3 or 4 days to see if it's beginning to work. If it does not, you will need to wait a minimum of 4 days after you last used one of these products before you can see your healthcare provider. What you do not want to do, which many women do, but you shouldn't, is fill your vagina with some cream, then change your mind and run to the clinic. You'll be wasting your money and your doctor's time because she needs to examine the discharge, not the cream that you just filled in your vagina. If you called my office for an appointment, they would not give you one until next week. If you get a yeast infection again shortly after you treated it yourself, I also recommend that you go and see a gynecologist or a gyno nurse practitioner next time you have those symptoms. So much on a straightforward, simple yeast infections. But then there are also the women who just can't seem to be able to shake yeast infections. They get them over and over and over and over again, but they never even seem to get better. The first thing for these women is again an exam and making sure that you are really dealing with a recurrent vaginal yeast infection. As we already learned, not every vaginal discharge or irritation is a yeast infection. It could be another infection or even an allergy or an eczema. Then, of course, you have to make sure the woman does not have untreated diabetes, because that can cause a lot more problems than just recurrent vaginal yeast infection. So you should check that out too. It is probably also reasonable to send a culture to the lab to find out which type of yeast infection it is, because some rare types of yeast need different medications. They don't respond to the usual one. And all these different medications are prescription only. If you treat these women with the usual yeast medications, whether prescription or non-prescription, the infection will not respond. It will not go away. But most vaginal yeast infections, however, are caused by a fungus called Candida albicans, and that responds to the normal standard treatments. In women who get recurrent yeast infection with Candida albicans over and over again, the first thing I try is giving them a slightly extended regimen, the one I'd already described earlier in the podcast. 1 pill by mouth now, 1 3 days later, 1 a week later, and then 1 a month later, and that's often enough, will do the trick. If that does not work, I will then go to a very prolonged regimen first described by a gynecologist from Belgium named Donders. This is D-O-N-D-E-R-S, Donders, in case you want to discuss it with your gynecologist. The woman then has to take a yeast treatment pill called fluconazole, for instance, for about a year. First, 3 times a week for 2 weeks, then once a week for 2 months, then once every 2 weeks for 4 months, and then once a month for another 6 months. This is pretty drastic, and I only use this a few times a year on someone, but so far it has never failed to work in more than 30 years. So it's definitely worth a try. Women with recurrent vaginal yeast infections are willing to try anything, even taking these pills for a year. Another reason for so-called yeast infections not to go away or for coming back all the time is that they're actually a mixture of yeast and something else, most often bacterial vaginosis, BV. If you only treat the yeast part and leave the other infection untreated, or the other way around, you treat the other infection and leave the yeast part untreated, the symptoms will first get better for a while, but they will never go away completely. You really need to treat both things at the same time. This brings me to the end of this podcast on yeast infection. I hope it gave you some useful information that you can share with other women and possibly even with your gynecologist if recurrent yeast infections is something you suffer from. Discuss that drastic Donders regimen with her. And if you have any further question about this or any other topic having to do with women's health, please don't hesitate to send them to me at questions@gynoinfo.net. Again, that's questions@gynoinfo.net. And if you like this episode, please give us a lot of likes and share it around far and wide. It will also be a super nice thing to do if you could subscribe to Gyno Info, because this helps Josh and me to keep this podcast going. Thank you. Until next time, thank you for listening, and remember that you and your health are super important and deserve your full attention. Don't ever put off contacting your doctor because you're scared or embarrassed when something feels wrong about your body. Doctors are here to help you and not to judge you. And also, regular well-woman visits are always a good idea that you should make time for. You deserve it, and you owe it to yourself, and you owe it to your body and your health. This podcast is part of Pride House Media, hosted by me, Dr. Burki, produced and edited by Josh Rosenzweig. Original music composed by Nell Balaban. If you enjoyed this episode, please subscribe wherever you listen to podcasts. And while you're there, leave us a rating and a review. It really helps others discover the show. Stay connected and join the conversation by following me on Instagram and Facebook at GynoInfo and on LinkedIn at GynoInfo Podcast. Remember, any questions that I answer or information that I give you on this podcast are to be understood as information only, not treatment of your medical problems. While I'm a very knowledgeable gynecologist, I'm not your gynecologist who has talked to you and examined you personally and is therefore actually able to treat you. So please consult your own healthcare professional with any medical questions or concerns.